Hi, everyone. Welcome back for our weekly Q&A with Dr. Niki Davis. I'm Chandler Rosenberg, Managing Director of Plant-Based Utah. Welcome, Dr. Davis.
Thank you so much. Good to be here.
Our question this week, should I take a calcium supplement to help prevent osteoporosis or fracture risk?
Okay, so this is something that I think can be confusing because for a long time, doctors were saying we should always take calcium and vitamin D to help make sure that our bones are strong. And things have changed a little bit. So what we found is that, so let's talk first about hip fracture, because that's one that a lot of people are worried about. Hip fractures can be deadly. So what we found in studies is that people who are given calcium supplementation do not see a reduction in hip fracture risk after giving that supplementation with the calcium. And in fact, what we found is that actually they have an increased risk of hip fracture with taking the calcium versus placebo. So in a randomized controlled trial, they showed a 64% increased risk of hip fracture in the calcium supplement group versus the group that was just taking placebo. So definitely if you're looking to prevent specifically hip fractures, I would say taking a calcium supplement is not what most doctors would recommend. Now, if you are looking at preventing overall fracture risk, so any fracture in the body, there is some evidence that shows that it can possibly be helpful to take a calcium supplement. But if you really look at the numbers, let's say that 1,000 people took a calcium supplement for 5 years. What you would see based on the studies is you would see that, yes, we might prevent about 26 fractures in those 1,000 people. But what we'll also see is that there will be an additional 14 people who have heart attacks. We'll see an additional 10 strokes and 13 deaths, all in the people who are taking the calcium supplement. So if you look at what the official recommendations are for taking calcium supplementation, the places where we look at, so as a family physician, we look at what we look at a lot of different places where people make the recommendations, but one of them is the AAFP, which is the American Academy of Family Physicians. And then we also look at the USPSTF. I know that's a big one, but it's basically the US Preventive Services Task Force. So both of those have said there is insufficient evidence for taking calcium supplementation to prevent osteoporosis, so specifically for osteoporosis. And they also say that for postmenopausal women specifically, it's actually recommended against. And that is because of the increased risks that I talked about earlier. So if you're looking to take, and actually they not only talk about calcium supplementation, but also vitamin D supplementation. So taking both the calcium and the vitamin D is recommended against in postmenopausal women. And there's just insufficient evidence for the rest of the population. So now the interesting thing though, is that if you're getting your calcium in your diet, and I'm not talking about anything that's fortified, but actual calcium in plant foods, you don't see that increased risk. So there's something about stripping that calcium, and taking it in just a calcium supplement that does increase those risks. So now I also want to mention though that, there are some people you want to talk to your doctor because, for instance, if I'm saying, well, it's recommended against taking calcium and vitamin D to prevent osteoporosis in postmenopausal women. If you're someone who has low vitamin D, you're going to want to talk to your doctor because that's different. I'm just talking about just the prevention of osteoporosis in general. So just make sure that you're talking to your doctor if you have any concerns about your vitamin D levels or your calcium levels.
Great. Thank you, Dr. Davis.
Yep, no problem.
We'll see you guys next week. If you've got any questions, please leave them in the comments below. Thanks for tuning in.